Pregnant women and their husbands often wonder if it is safe to have sex during pregnancy. Most of the time, people do not know whom to ask this question and are even hesitant in asking their doctors about this. Will it cause a miscarriage? Will it harm the unborn baby? Does the baby know what's happening? And how to do it safely? So here is what to know. Is sex safe during pregnancy? Yes, it is. Sex is a natural and normal part of a couple's life during pregnancy. Penetration and the intercourse movement does not harm the baby. Baby is well protected and cushioned by the amniotic sac, the mucus plug at the mouth of the uterus, the muscular uterus walls, and finally your abdominal walls. Can sex trigger labor? Not really. The contractions of the orgasm aren't the same as the labor contractions. These are transient tightenings of the uterine muscle. These are known as Braxton Hicks contractions, and they usually quickly pass off on their own. Still, as a general safety precaution, your doctor might advise you against having sex in the final weeks of pregnancy, as the hormones in the semen sometimes can stimulate contractions. These hormones work in a similar way like the hormones known as prostaglandins. For the same reason, having sex in the post-dated or overdue pregnancies also sometimes can help to induce the labor. Sex drive during pregnancy. Every woman's experiences during pregnancy are different, including how they feel about sex. For some, the desire fades during pregnancy, while some women feel more deeply connected to their sexuality and more aroused when they are pregnant. Some actually feel that their desire actually goes up because now they are not worried about the birth control. So during pregnancy also, it's normal for the sexual desire to come up and go as your body changes. You may feel over-conscious as your belly grows, or sometimes some women actually feel sexier with a larger or the fuller body. In first trimester, because of nausea, fatigue, or sometimes breast tenderness, it actually might kill your sex drive. Do not worry, it will come back. In the second trimester, as the women generally become more comfortable, the sex drive might come back. The third trimester, the sex now may actually feel very uncomfortable in the last few weeks of pregnancy because of the uncomfortable body size, anxiety and worry about the childbirth, whether this would harm the baby or not. Sexual positions in pregnancy. Lying flat on the back in the normal missionary position for the sex after the 4th month of pregnancy may not be really safe or comfortable, as it is actually difficult with the baby's bump in between. It may not be really safe also because in this position the weight of the growing baby constricts the major blood vessels at the back, which are actually supplying the blood to the baby and the uterus. So avoid lying back or avoid lying flat on your back after the 4th month of pregnancy. Any position actually which reduces the pressure on your belly is safe. It can be woman on top, it can be on the side, it could be anywhere, any position in which there is no direct pressure on the belly. In case of vaginal dryness, you can use a lubricant to make the sex more comfortable. In case the sex is still uncomfortable, you can enjoy intimacy in other ways too. Oral and anal sex. One big caution, it's absolutely unsafe and dangerous for the partner to blow air into the pregnant woman's vagina. Remember, this can be life-threatening. It can cause air embolism. It can be immediately fatal. Anal sex will not harm the baby, but it may be uncomfortable in case a woman has pregnancy-related hemorrhoids. Should I use a barrier contraception or condoms? As always, if you are not absolutely sure about your partner's sexual history, you must use a condom. Remember, pregnancy does not protect you against sexually transmitted infections such as HIV, herpes, genital warts, chlamydia, and these infections can affect your baby too. So please take your call wisely. Very important, when not to have sex during pregnancy. Number 1, in case you are at risk of miscarriage or have a history of past miscarriages in the previous pregnancies. Number 2, in case you are at risk of premature labor, which is you're having contractions before the baby matures, before 37 weeks of pregnancy. In case you're having any kind of vaginal bleeding or any kind of infective vaginal discharge. In case your amniotic bag is leaking fluid or you have ruptured membranes. In case your cervix has opened too early and your doctor has told you to be on bed rest. In case you already have a cervical stitch in place. Now that's a stitch which we place at the mouth of uterus to make sure that the cervix does not open before time. In case your ultrasound says that you have placenta previa, which means the placenta is low-lying. In case you are expecting twins or triplets or maybe multiple pregnancies. Red flag signs after pregnancy sex. So in case these signs happen, immediately inform your doctor and report to the emergency room. Number 1, any kind of pain in the lower abdomen, any kind of contractions in the uterus. So this is transient tightening which is now not getting all right. Second, vaginal bleeding or any kind of a watery, thin watery discharge from vagina. Any significant discomfort. What if I don't want to have sex during pregnancy? That's perfectly all right. There is more to intimacy than sex. Discuss with your partner in an open and loving way. If sex is difficult, unappealing or off limits, it's okay absolutely to not do it. Benefits of sex during pregnancy. Now, sex during pregnancy can also have certain benefits. Number 1, it keeps you fit. Sex burns calories and can help to keep both the partners fit. It improves the bonding between the partners. Some couples find that sexual activity in pregnancy actually brings them together. In a study in 2004, it has been found that sex during pregnancy can actually give a boost to the immune system, increasing the levels of IgA, which can fight many infections. It causes increased happiness. The sex during pregnancy releases endorphins, which can make the mother and the baby both feel happy and relaxed. Sex after delivery. The first 6 weeks after the delivery, this is known as postpartum period. Now, sex during this time may be the last thing on your mind. You may have very less desire because obviously there are stitches. You may have stitches down below. This is known as episiotomy. This is the incision which is given at the time of vaginal delivery. You may be healing from the abdominal incisions in case you've had a cesarean birth. Generally, women tend to have bleeding till about 6 weeks after delivery. So that also, doesn't make you feel comfortable to have sex. Fatigue after pregnancy because, you're obviously tired, you've given birth to a baby, you're looking after the baby, you're not really sleeping well. The changing hormones levels. So post-delivery, suddenly there is a fall in the level of the estrogen and the progesterone. So obviously it changes lots of things in the body too. You may be having sore breast from breastfeeding also. A lot of women face postpartum blues, anxieties, overparenting, relationship issues, and a lot of other things. As doctors, we always say that it's a good idea to wait for at least 6 weeks after delivery before any kind of intercourse. It's very, very important to be emotionally ready, physically comfortable and relaxed. Remember to use a proper contraception, as fertility can resume anytime after 6 weeks of delivery. It's very, very important for all of you to know that ovulation can begin anytime 6 weeks after delivery. In case you want more information about the contraception, you must follow our contraception series on Maitri. Some subjects need to be talked about and spoken openly. At Maitri, we believe in making uncomfortable conversations easy and comfortable. So today, like always, if you found this information useful, please do not forget to like, share and subscribe to Maitri, and I will see you soon.